Order, order. Welcome to the public session of the Science, Innovation and Technology Select Committee. And before we start, I do want to welcome Leila Moran, the chair of the Health and Social Care Committee, who is our first guest and will be joining us for this morning's proceedings. Now, I'd also want to start by saying how excited I am to introduce this, which is my sort of own innovation for the committee, with the support of the entire committee, which is the first Innovation Showcase session. The UK has fantastic innovators, scientists, businesses, technicians, technologists, researchers, up and down our country. They develop the products and services that make life better for all of us, but too often we don't hear enough about them. We don't know their stories, their successes, their failures, their opportunities, their challenges. We don't know what might be just around the corner. So the committee wants to understand how the UK supports innovators and what more can be done. And to inform our work, each member of this committee will take turns to select an innovator to share their story before our main evidence session. And we will use their experiences to inform our scrutiny and to make recommendations to government. We expect this to be an iterative piece of work, potentially running the full length of the Parliament. So we're starting today with my first choice, Dr. Maria Labus. She is the founder and CEO of Newcastle University spin-out AMLo Biosciences Limited. I chose AMLo because their innovation is about something, well, we all know about, we all fear, if you like, cancer, and specifically skin cancer. And it can help to save lives as well as helping the NHS provide better patient care through improved diagnosis and better use of resources. Dr. Labus leads an all-female exec team and is concerned that only 3% of funding goes to female-led innovators, as she believes radical change in attitudes is required to make commercial reality from the fantastic potential arising from British and especially North-East innovations. Dr. Labus, you have 10 minutes to present your innovation.
Thank you very much. Well, good morning and thanks for giving me the opportunity to be the first company to come and speak to you here in the committee. And I want to tell you what we're doing to improve outcomes for patients with early stage melanoma. So as she said, I'm Maria Labus, I'm the female CEO of AMLo Biosciences. And we're based in Newcastle upon Tyne in a thriving ecosystem of life science companies, which are spun out of our 5 wonderful universities up there. But I think we started AMLo, myself and my co-founder, Penny Lovett, because we were really interested in personalised medicine. And that means that every patient is treated based on their own disease rather than a one-size-fits-all. And we saw a real opportunity and a real need in melanoma to do things differently. So what do I mean by that? So this is a skin biopsy, which is taken from a patient with a suspected melanoma. And this goes to pathology, and they take a couple of sections from it and stain it pink so the pathologist can see the cells clearly. And in this case, there's a melanoma here in the top layer of the skin between the epidermis and the dermis. Now, the good news about melanoma is that most melanoma diagnoses are made at this stage when there's no evidence of spread. And that's a good thing because melanoma is the most serious of the skin cancers because it likes to spread. But the bad news is that even though these diagnoses are made early, 15% of these patients will go on to develop metastatic disease, requiring surgery and drug treatment. And that's absolutely no way that the pathologist can look at this early biopsy and tell who's going to develop metastatic disease and who won't. So what happens to these early stage patients is they're all treated in the same way, as if they're at risk of developing metastatic disease. And this watchful waiting causes huge anxiety for patients because they have to return to hospital regularly for up to 5 years to be monitored. It uses a lot of resources within the NHS unnecessarily and ultimately adds to waiting lists, and they have poorer patient outcomes. So the other challenge with melanoma is that this is a cancer which is increasing in incidence at an alarming rate. So partly that's because of an ageing population and people like myself, and I include myself in that demographic, who went out in my youth with no sun protection because the publicity around the damage that UV caused wasn't as well known as it is now. And now we're ageing, the melanomas are a result of this uncontrolled UV exposure. But I think more alarmingly in the younger population, especially young women, the incidence of melanoma is really increasing because of sunbed usage. So we speak to our clinical colleagues who tell us there's a tsunami of new cases on the horizon, and there's no way that our healthcare systems can manage this through this watchful waiting. So how are we addressing this? Well, this little packet, which contains 2 antibodies, is our first product, AMLo. And we've developed this through 7 years of blood, sweat and tears and £8 million of investment to get to the stage where this product is now approved for use in the UK and CLIA approved for use in the US. And we truly believe that these 2 antibodies in this packet could be game-changing for the management of early-stage melanoma. So how does it work? So this is the same biopsy I just showed you, but in this case, it's been stained with these 2 antibodies in the packet. And that's the brown staining you can see here. So it stains the skin overlying the melanoma. And these 2 proteins, AMLo1 and loricrin, are present in everyone's skin normally. And what we've shown through our extensive clinical validation is that if a patient has a melanoma tumour which is at low risk of spread, you see the same picture, you see the same staining of these 2 proteins as you can see in these 2 boards. But if that melanoma is at risk of spreading, the pathologist will see gaps or pieces of staining which doesn't exist anymore compared to the normal skin. So it's quite simple for them to identify a tumour which is low risk versus a tumour which is at risk. It's very simple to do. It uses the same biopsy which is taken to diagnose the melanoma, and it can be done in the same pathology lab where the diagnosis is initially made. So if a patient is low risk using this test, they can be reassured that they're at very low risk of actually having a metastasis. They can have a more conservative follow-up, saving money, saving resources, having a positive impact on waiting lists, and it allows those healthcare professionals to focus on the patients who are genuinely at risk of the disease spreading. And ultimately, that will improve the patient outcomes.
Brilliant.
So, the next stage for us is to get adoption of this widely in the UK and the US. And that's where the real hard work begins. Because getting adoption of new innovations in healthcare is very difficult and very expensive. So we're currently trying to raise another round of funding. And that's really challenging because in the UK, there's a limited number of funds which will actually invest in a company at my stage. And then, as she said earlier, less than 3% of funding goes to female-founded companies. So I'm up against a real challenge here to get my company funded. So the last 6 months, I've spoken to investors who are not based in the UK, mostly in the US. But the challenge for a UK-based company is that these investors will try and encourage you to relocate outside of the UK as part of the investment deal. And that then sucks innovations out of the UK. It means that UK patients are unlikely to benefit, we lose jobs, and the economy fails. But our early work, which got us to develop this AMLo, was funded originally by UK charities. So for us, it's really important that UK patients actually benefit from this technology. But the next challenge we face is getting innovations into the NHS. The NHS is not encouraged to be innovative. They want to do the things like they've always done the things. And the process for adoption is bureaucratic, it's slow, and it's very focused on drugs. So what we've found with AMLo is that adoption in the US has been far easier and far quicker than it has been in the UK, and that's really disappointing. So what we would like is for NHS trusts to change the mindset and to be empowered to adopt new innovations quickly into the NHS, and that's something that the government could help us with. But I don't want to end on a negative note. I mean, I think the future is really bright for us as a company and for the ecosystem that we have in the UK. And other than AMLo, we've got 5 other products in late development which could also help other patients with different skin cancers. And once on the market, they'll help clinicians to treat patients based on their own individual risk, they'll save resources which can be invested elsewhere, and ultimately they'll improve patient outcomes. And that's why we started the company. And thank you for listening.
Thank you very much. Thank you very much. Thank you. Order.
Am I allowed to ask a question?
I'm afraid it's
How much are you trying to raise?
We're trying to raise 10 million currently.
Okay, all right. Order.